Does breastfeeding feel painful no matter how hard you try to get it right? Is your baby always sleeping up or not staying latched for long? Maybe you have heard that breastfeeding is supposed to be natural, but it's just hard. If you saw this video and asked any of those questions in your mind, then you are exactly in the right place. Today, you are going to learn the exact latching techniques we pediatric nurses use in special baby care unit to help new mom breastfeed pain-free, even if it is their first time. I am a registered nurse with 3 years of experience working in special baby care units. I have helped hundreds of new moms with breastfeeding from first latch to full milk flow. I started creating videos like this as a total beginner just to help women in Areocom understand pregnancy, labor, postpartum recovery, breastfeeding, baby care, and many more in a simple English. So, trust me, you are learning this from someone who lives and breathes baby care every day. Let me tell you about Amina, a first-time mom I met just 3 months ago. She wanted to breastfeed her baby exclusively, but every time she tried, she would cry out in pain. The baby won't latch properly and her nipples were cracked and bleeding. She thought about giving up and switching to baby formula, but then I showed her this one gentle latching trick we use in the hospital, and after just 2 tries, her baby latched deeply and she didn't feel any pain. Now she is being breastfeeding exclusively for 3 months, happy, confident, and pain-free. And that's what exactly I want for you too.
Ready.
Start with a calm baby. Let's assume this is our baby. She is crying. Crying babies are harder to latch. Hold your baby skin to skin and calm them first. Then try feeding. The second one is holding your baby tummy to tummy. This is the second technique. Make sure your whole body is facing your whole baby's body is facing you. It's not just their head. Then this makes it easier for them to latch very well. Let me demonstrate this. Here is your baby and here is my tummy and here is my baby's tummy, and I hold her like this. This makes latching very easier and very stress-free. So the next technique is nose to nipple. Make sure you align your baby's head towards your nipple, opposite your nipple. Your baby's nose is facing your nipple, not his mouth facing you, because this will give your baby enough room to tilt her head like this and help her to open her mouth widely, and this will make latching simpler and easier. Then wait for the baby's mouth to be widely open. Don't rush this step, because tickling their nipple, tickling your baby's lip with your nipple will make them open their mouth wider, like they are about to yawn, like that's your moment. Then you will put your breast gently to their mouth. Then they will start sucking. Gently put your breast into your baby's mouth and make sure she latch very well, because not just nipple that you will start sucking. Make sure some part of your areola are inside your baby's mouth, and this will make sure that your baby is latching very well and getting enough breast milk. Their chin should touch your breast and their nose should be free without any blockage or something like that. You want to make sure your baby doesn't spit up or gas